Ethiopian Thoracic Society is established in 2014 with dedicated physicians of pulmonary critical care and fellows on training on pulmonary critical care, cardiothoracic surgeons, and also anesthesiologists. With a group of these people, this society was established in 2014.
And the first meeting of the conference was announced in 2014, where we had our graduation as well, the first fellow.
The beginning of the Ethiopian Thoracic Society was really the initiative of all of you, with leadership from people like Dr. Amsalu, Dr. Tedros, Dr. Getachew, Dr. Aschalu, and many others. There was a desire to create an organization where all the people interested in lung health in Ethiopia could come together and discuss the latest advances, the needs, the challenges, and the opportunities for education around lung health. This is an organization that has brought together physicians, surgeons, respiratory therapists, nurses, pharmacists, and students to come, discuss, learn, teach, and develop an agenda for improving lung health in Ethiopia.
In terms of the involvement with the healthcare, particularly related to the expansion of the MDR TV, they serve as chair of the technical panel that decides on the technical details on the patients that are receiving the multi-drug resistant TB medication. And as to my knowledge, the society is also engaged in partnering with overseas companies and organizations and importing different supplies and equipment to enhance the quality of care and of particularly of respiratory illnesses. And they are also engaged in different technical working groups that provide technical assistance to the Ministry of Health.
We achieved a lot of progress in terms of really capacity building in the area of lung health, and also in terms of really supporting the ministry in the area of improving lung health and also control of tuberculosis, and also in the development of guidelines, and also we are involved on also fight against COVID. Our team are largely involved in giving guidance, in giving training, and also in really handling cases at hospital level, and also in supervising. So really our society plays critical role in fighting this kind of pandemic. So
recently, one of the big achievements of our society is our role and a big project on lung cancer. So unfortunately, we are shifting from diseases which are infectious, predominantly TB, at the start of the society. And now we are shifting to more malignancy cases, which have not only primary lung tumors, but also we have metastasis to the lung. So this big lung cancer project was started almost 4 years back. So we have finished our first phase of 3 years project. So we have started not only a routine bronchoscopy service has been more elaborated and functionality has increased, but also we have imported the first EBUS endobronchial ultrasound machine for the country. So it is one of a big achievement, and we have been taking samples from mediastinum which have been previously unreachable. So with that we have diagnosed a lot of lung cancer.
The other job we did was supporting patient associations. We gave a lot of educations and also promotions activities were done for Asthma and Allergy Society of Ethiopia.
And we have been engaged also in risk reduction and different risk factors that may contribute to the development of different pulmonary diseases. This includes like smoking, and we have been an advocate for endorsement of the proclamation again, is the control of tobacco smoking and air pollution. And with this, we have participated in the process of development of the proclamation and its endorsement. And finally, we are successful to have the strong tobacco control proclamation in the country. The other one is also we have worked with on air pollution. So we have contributed a lot on its monitoring regulation, and we have developed recommendations on the future access to clean air for healthy lung.
One of the things which have been neglected and we plan to do in the future, and we have started doing it, is to give emphasis on quality of life of our patients. So we have passed through mortality. We are still having a lot of high mortality, but we have also a lot of survivors from chronic illnesses, namely tuberculosis. So we have incorporated post-TB complications with patients who are suffering with related known morbidities like bronchiectasis, fibrosis, restrictive lung disease, pulmonary hypertension, aspergillus infection, and so on. This group of patients have been neglected, and because of the disability, which is in a young population, so they cannot perform, they cannot work. So this is a huge bulk of group of survivors post-TB, and it has been incorporated, and Ministry of Health has been very collaborating with us, and post-TB lung disease have been now included as part of other lung disease together with TB program. So that's a huge achievement.
Since the inception of Ethiopian Thoracic Society, Ethiopia's TB program has transformed due to their engagement in development of policy guidance and early adoption of global technologies, new tools, new initiatives like new diagnostics, latest treatment regimens, including drugs, and they have been very much engaged in the development of evidences, particularly in research, post-capacity building, and producing evidences. So this has been influencing the system and ourselves in terms of changing the life of Ethiopians.
It's a growing and impactful professional association. It's composed of highly prominent and credible individuals with high caliber of expertise and acceptance throughout Ethiopia.
The achievements of ETS have really been remarkable and can be divided into several areas. First, ETS provides a forum every year for all those people who I mentioned to come together and learn from each other, hear about the latest situation in tuberculosis, asthma, COPD, tobacco control, all the issues that are important for lung health in Ethiopia. Everyone comes together to share information, to learn from each other. Secondly, I think ETS has become a forum where people can see the latest data and the latest research that can help improve the lives of people with tuberculosis, with COPD, with asthma, people who are working in occupations where they're exposed to air and other substances that could damage their lungs, how to protect themselves from that. This has really, I think, been an important function of ETS and one that really will continue in the future. Also, and I think very, very importantly, ETS has become an important forum for advocacy for patients with lung disease or facing challenges to lung health in Ethiopia. Through the efforts of ETS, important things have happened in the country to protect people from things like tobacco, to do more to make access to services for tuberculosis available, to improve access to medications for asthma and COPD, to exchange ideas and information with representatives from the federal and state ministries of health, from USAID, to interact with these people so that the voices of the medical community in Ethiopia are heard and the voices of patients with lung disease in Ethiopia are heard.
We have been working with them in the USAID current Eliminate TB project. They are sub-grantees to the USAID Eliminate TB. So as sub-grantees, we are organizationally supporting the ETS because it is we want it to be a strategic partner to the national TB program.
In terms of addressing diseases of public health importance, particularly on tuberculosis, we wanted the latest standard care technologies, medicines in place when we are there. And ETS was one of the pioneers who helped all of us who partnered with USAID and our implementing partners like USAID Eliminate Tuberculosis, USAID Challenge TB, USAID Heal TB. These are the projects that we implemented and Ethiopian Thoracic Society partnered with in terms of producing guidelines, in terms of adapting new global developments, and in terms of generating local evidence that can inform the national program to develop and implement a nationally customized strategy and intervention. They did a lot of job in terms of developing MDR-TB guideline, critical care support for MDR-TB patients. If you compare ETS with other similar associations of health profession as well as other sector, it has thrived a lot, contributed a lot.
Been working with ATS for the last 3 years on lung cancer project, which we are a lead implementer, and ATS as one of the 5 implementing partners. And the lung cancer project implemented for the last 3 years in Ethiopia, in Addis, Oromia, Amhara, and Afar. And the contribution of ETS was immense because as a local professional organization, they have supported the project in terms of developing IEC, BCC materials, in developing guidelines, teaching materials, and they also supported us in training TOT for various implementing partners at various levels. And they have also supported us in managing a very big research being conducted at Addis Ababa University.
So the society should be working on developing different guidelines, protocols in the area of respiratory health and critical care medicine.
I and my colleagues identified different chest and chest related problems, so I expect ETS or Ethiopian Thoracic Society to be involved in much of the gap, both clinical and information gap and management related gap related with the chest and critical care. And so many of the problems that I identified needs a quality research program. We are moving to patients related other lung disease. As I mentioned earlier, post-TB is one of it. Lung cancer is another disease which we focus, and also occupational lung disease.
The future, we are planning to do more for the better lung health in the country.
And I'm hoping that in the future, I want to see ETS developed, progressed.
In the future, my wish to see ETS after a decade or 2 decades is to be a leading professional society in research in terms of pulmonary and critical care, and also a big institute.
The society has to recruit more members, especially from related professions such as, from the thoracic surgeons, basic science like pathology, microbiology, and public health professionals, particularly those who work on the environmental health.
Therefore, we should develop a good strategic plan in the coming 10 years, strengthening the members' commitments.
In the next 10 years, our strategic plan will be revised to incorporate a new vision, a new mission, and also values. Having said that, we plan to develop our leadership skills by designing a leadership initiative which will build working groups with a specific interest in health, in respiratory health and critical care. This also will be supported by designing an efficient administrative support to enhance or to support our members' activity in our society.
Excellencies, esteemed guests, and members of the Ethiopian Thoracic Society, good morning all, and welcome to our 10th year Ethiopian Thoracic Society Anniversary Research Day.
Good morning, esteemed guests, distinguished colleagues, and all protocols observed. I warmly welcome you as we gather with great honor to celebrate the 10th anniversary of Ethiopian Thoracic Society and to participate in our research day themed Improving Respiratory Health Through Research and Innovation, where scientific discussions will take place.
We are gathered by the common goal to improve the thoracic and respiratory health in Ethiopia and beyond.
While we celebrate the 10th year anniversary of the Ethiopian Thoracic Society, and it's a landmark that symbolizes the long journey towards improving respiratory health.
Platinum sponsor, Tushao General Trading.
As we're on TV, otherwise really there is no strong data on other chronic respiratory disease. So basically it was one of the areas which was much neglected. So this society thrives and create a lot of connections, and really now we have a very different research platform, and we have also a very ongoing researches.
Especially household air pollution is the leading cause of those chronic respiratory diseases. Here is the main content or the manuscript main body. Here we start with introduction. The introduction provides context about your study. Authorship, the 4 Gs, like ghost authorship. This means there is someone behind the screen who can write the paper but not included in the article. The AAU has some subscription for reading or accessing those non-open access or subscription-based type of journals.
We will have around 7 abstracts to be presented. The first presentation will be on role of artificial intelligence enabled chest X-ray interpretation to detect lung nodules and pulmonary tuberculosis in low-income country. This will be presented by Dr. Amsalu Bekkele.
So this is one of the projects going on in our department. This is the role of artificial intelligence enabled chest X-ray interpretation for detection of lung cancer plus detection of pulmonary tuberculosis in Ethiopia.
The entitled Spatial-Temporal Pattern and Future Trajectories of Tuberculosis in Conflict is an implication for health system resilience and preparedness.
Prevalence, clinical characteristics, pattern of post-tuberculosis lung disease in chest clinic, St. Paul's Hospital, Addis Ababa, Ethiopia.
Treatment outcome and associated factors of multi-drug resistant tuberculosis patients treated with midazolam-based regimen at Northwest Amhara.
Pulmonary function impairment and its associated factors among patients treated for pulmonary tuberculosis at the Baba Gyon Specialized Hospital.
Atypical manifestation of common disease.
A case report on 55 years old woman from Addis Ababa.
የኢትዮጵያን ቶራሲክ ሶሳይቲ የሶሻል ሚዲያ ፕላትፎርም
Nathan, who is our PhD candidate at School of Public Health.
So, one of the reasons behind the late presentation of patients at a facility might be the awareness of the symptoms. My conclusion is that all the 3 delays contributing for significant late presentation, so we have to work on these 3 delays to change this current situation.
Attributes and factors associated with long COVID among patients hospitalized for acute COVID-19.
Population structure of childhood TB in Ethiopia.
Is geographical weighted regression, analysis of hotspots of acute respiratory infection and its associated factors among under 5 children in Ethiopia using spatial regression and multi-level analysis.
Prevalence, risk factors, and treatment outcomes of empyema. It's an experience from a developing setup.
Magnitude and treatment outcome of pleural empyema thoracis in children admitted to St. Paul Hospital.
The prevalence, possible causes, treatment outcome, and associated factors of pediatric acute respiratory distress syndrome.
Applause for all the presenters and for the audience.
After our reviewers have concluded their last result in accordance to the criteria that was given.
Our distinguished reviewers are taking a rank of the presentations from morning to now.